Glad to be with you guys today. And I'm going to talk about contributors of brain fog and precursors to dementia. So I hope this is a stimulating discussion today. I'm going to teach you how to play doctor. I'm going to teach you how a doctor thinks when we're looking at things like brain fog. Now, it's interesting in the world of brain health, is brain fog an actual diagnosis? Nod your head yes or no if brain fog is an actual diagnosis like major depressive disorder or bipolar disorder or Alzheimer's disease or COVID. Okay? It's not. Now, I'm going to give you an analogy just because I want to kind of get the creative juices flowing today. When I first started practicing medicine, I graduated Idaho State University as a nurse practitioner in 2004. And in 2004, there was a new diagnosis or a new description that came out called fibromyalgia. And no one knew what to do with fibromyalgia. Half the doctors in the world thought, oh, it's all in your head. You don't have fibromyalgia. It doesn't even exist. There's no diagnosis of fibral dementia or fibromyalgia. We don't even know what it is. And then as time went on, we started recognizing, oh, there's characteristics of fibromyalgia that are common amongst patient sets. And then it became a formalized diagnosis. Now there's an ICD-10 code. There's actually drugs that have been approved for the treatment of fibromyalgia and a bunch of drugs that are used kind of off-label, if you will, to try to make the symptoms of fibromyalgia better. Now, from my standpoint, I want you to know that I think brain fog is very similar to that. There's going to be a time where brain fog is recognized as an actual problem. Whereas right now, it's kind of just this goofy descriptor. So I want to talk to you about what brain fog might be and what are and could that be a precursor to dementia? And today I'm going to ask you to keep score. So this is what I want you to do. I want you to take a piece of paper out and put it on your desk. You don't have to take notes, but I want you to make some hash marks where if I say, do you have this? I want you to put a hash mark. And at the end, I'm going to ask you to disclose how many hash marks you made, because this in some way would be a scorekeeping exercise of brain fog or precursors to dementia. So let's get started. My good friend, Dr. Datis Karazian, he lives in San Diego. He's amongst one of the world's most revered functional medicine practitioners. I've been to his house a couple of times. I've had dinner with him as early as July of this year. He's just become such a good friend. And he came up with this scale. And he called it something different, but for the purpose of my lecture today, I'm going to call it the brain health and sickness scale. So it's your brain health or your brain sickness scale, okay? And he talked about this in his book, Why Isn't My Brain Working? So I want to give him all the credit in the world because, man, he has just really influenced how I look at dementia, how I look at brain fog, how I look at depression, anxiety, attention deficit disease, Parkinson's disease, you name it. Okay, so let's start. Brain fog is this perception where someone starts to feel slow. And they might say, man, I don't focus like I used to. I can't stay focused on a task for very long. I read a book and I can't remember what I just read. My reading comprehension has gone down. I can't pay attention very well. I don't follow things. I can't find my words. My memory's not what it used to be, but I guess I'm 60 years old, so I just have age-related memory loss. My brain gets tired. You know, it's so interesting. I hear that term a lot. My brain feels tired. Well, no one knows what to do with that. That's such a tricky statement. So I'm going to call it brain fog. And in this scale, it can kind of ratchet up where sometimes you just say, well, I didn't sleep very good last night, so I'm kind of foggy. And other times you might say, man, something is legitimately wrong. It's just not, I'm not tracking right. I keep ticking up. So brain fog kind of falls into this spectrum of a number of symptoms that kind of come and go off and on. You're not sure what's going on. And then at some point, you get sick and tired of the symptoms. So you go to the doctor and you receive a formal diagnosis. And this formal diagnosis can be called many things. They might say, Well, Randy, maybe you're a little depressed. Maybe you got some depression or anxiety. Actually, maybe you have attention deficit disorder. Maybe it's PTSD. You went through that terrible job loss last year. Your mom passed away. Maybe you're grieving. So it's a little bit of PTSD. Or that ringing in your ear, darn it, we're just going to call it tinnitus. We don't really know what to do with it, but we're just going to call it tinnitus, right? And you often get a prescription for that said diagnosis. Now, it's interesting. You're not treating the underlying problem. You're just treating this formal diagnosis with something. So if it's depression, we're going to give you serotonin, right? Only about 50% or less of people that receive depression medicine actually feel better. They don't feel any better. 50%, one in two. That's quite the treatment failure, right? What if every surgery that you underwent, your doctor said, hey, there's a 1 in 2 chance this will work, and 1 in 2 chance it won't, and you'll have terrible side effects? Would you do surgery very quickly? Right? Pretty interesting. So when brain fog and these kind of arbitrary symptoms worsen to the point you get a diagnosis, hopefully they get better with treatment, but many times they don't. Mary Price just talked about her husband having a diagnosis of sleep, and he's got Parkinson's and other illnesses, and we just keep throwing medicines at him because we're not really sure what to do with it. We just can't find the underlying cause. Then the next component to that is we get a different diagnosis, which is usually more formidable. So they might say, well, now you have Alzheimer's or Parkinson's disease, or you're starting to sundown and you've got this terrible disability with your gait and you can't speak anymore and you have a blank stare and you bite your caregivers and it's just awful. And so usually when the diagnosis gets more aggressive, this is what happens. We get more and more medicines along the way. Okay? And it just feels like sometimes we chase our tails. We just really struggle. So at A Mind for All Seasons, we've kind of come up with an approach to say, hey, look, maybe we should start looking for underlying causes. And if we can find that underlying cause, we might actually start backtracking on some of these awful symptoms and improve the quality of life that someone is having. Okay? Now, I'm going to change directions and I'm going to say, let's say that we catch this early on. So we start feeling slow and we lack focus and memory and so forth. And this is actually just brain fog. And now we intervene instead of waiting until we get a formal diagnosis of depression, anxiety, PTSD, Alzheimer's, Parkinson's disease, cervical dystonia, whatever you want to call it. What if we start looking for the underpinnings now and we work backwards at a much earlier time frame, right? When we do that, everyone on this call or this presentation would agree that is by far the best way to do this. But the way you do this is you have to start looking for the underlying causes of brain fog in the first place. You have to have the presence of mind to not blow it off and say, well, I'm getting older. I'm just aging. So I'm going to really try to sort through this. Well, what would you do? If you go to a practitioner that really understands this, that practitioner is going to help you keep score. So this is what I said I want you to do. I want you to get out a piece of paper and you're just going to start making hash marks like this as I walk you through a series of questions that I've called the brain fog risk factor scoring tool. So we're going to identify all of the potential risk factors of brain fog that I can think of. Now listen, there's a million of them, but I just started trying to type these out. And I'm going to do an interview with you, and instead of me taking notes, you're going to take notes, and you're going to just write hash marks. Yep, I struggle with that. Nope, I don't have that. No hash mark. Yep, I have that issue. So I'm going to share a different screen now, and I'm going to shift over to a Word document that I prepared. Okay, so here we go. With this Word document, put my camera in a different spot because I got several monitors here that I'm looking at. So the first question I'm going to ask you, I've put this in red. can you as the patient or can any of your family members first identify when your concerns became evident? So, for example, a person might say, yeah, I really tanked when I got divorced. I really started falling apart when I had a job change or when I retired or when my mom died, when I experienced menopause, when I went through that surgery, everything was different. When I had that car accident, when I had COVID, right? I've just listed a couple of those in this area. But I want you to think of, was there an identifiable trigger where you said, yep, I'm starting to really struggle with some of these brain fog symptoms. I'm not doing very well. I'd like to try to figure that out. That clues someone like me, whoa, I lost my camera. That clues someone like me into, okay, now I know where to start. I know where to look for these common challenges. The next question I would ask you is tell me a little bit about your mental health. Because mental health is directly related to brain fog. If you experience terrible depression, or if you had a period of time in your life where you had terrible depression, that's insightful for me. That tells me something was wrong with the prefrontal cortex. That tells me that something's wrong with the limbic system in your brain, and we might be able to start sorting that out. How about anxiety? Was there a time you became bipolar? Bipolar in medicine, there's bipolar 1 and bipolar 2. Bipolar 1 is described as a person that actually loses touch with reality. They kind of had a psychotic break where maybe they heard voices or they started seeing things or they had delusions that their spouse was out having an affair when they're married, when that's not the case at all. There's a million things where bipolar 1 could happen, or schizophrenia, right? Is there a time where obsessive compulsive disorder happened? I have a sweet little patient that's 9 years old. She got strep throat, started an antibiotic and instantly had obsessive compulsive disorder. Had to wash her hand 55 times before she'd leave for school. Her hands were cracked and starting to bleed. I had another patient. She's a teenage girl. Saw her this last year. She was bucked off a horse, hit her head, had a slight loss of consciousness, and almost within the week started having panic attacks. Could not go to school. Just the most horrific panic that you can ever imagine. Well, that was tied directly to that head injury. So the first patient, obsessive compulsive, tied to a strep throat infection. Another one, terrible panic and anxiety disorder tied to a concussion. My next question is, do you use mental health medicines? Now, I'm not judgmental of that, but that receives a hash mark. You get a score for that. If you have to take a medicine to improve your mood or your anxiety level, I want to know that. That tells me there's a risk factor impacting mental health. Let's go on to the next category. How about a family history of dementia? Now, this does not mean that I think it's purely genetic. If your mom had dementia, you get a hash mark, but that doesn't necessarily mean I think you're going to get it, but it helps me to recognize what's going on in your family. I have had it both ways. I have had people that come to me and they've got brain fog and they say, my mom died of Alzheimer's disease at 72. My dad died of Alzheimer's disease at 69. My grandfather died of Alzheimer's disease in his 50s and had to retire early. And then you give me all this history, and I think, wow, I wonder if your parents experienced brain fog in their 40s. That tells me there's a risk factor I have to pay attention to. So what's going on with your family history? And we could say, well, tell me about your family history of depression. My whole family has major depression. I have 4 brothers with schizophrenia, right? Then I might say, okay, this is a serious issue in your family history. We're going to take some real measures to improve your health. So that gets a hash mark. I just went through the family history and mental health. Sorry, if you were not seeing this before, I've listed these out, but I've already covered them. So you're good. You've made your hash marks. The next one what is your education level or your career or your cognitive reserve? Now, let me explain what this means. if I have an individual that has a PhD, is an electrical engineer, and worked in a very complex environment solving complex problems, that individual can experience brain fog and no one would probably know. They can blow it off as indigestion and a bad night's sleep for a long time. That individual has a lot of brain power, and so they can lose 10% of their brain power, and no one has any clue they've lost 10% of their brain power. Okay? So I want to know, did you graduate high school? Did you graduate college? What level of career did you have? This tells me what kind of basis your brain function has, and it tells me your cognitive reserve. So when I do cognitive testing, I want to know that. Okay? So if you have a high degree of education, that's a high degree of cognitive reserve. If you didn't graduate high school, it doesn't mean you're not smart. If you didn't graduate college, it doesn't mean you're not smart. But it might mean that that our ability to detect a problem changes as a result of that. The next one I want to talk about is chemical exposures. I just want you to ask yourself, do you have known exposures that put you at risk? And I want you to give yourself a hash mark for every one that you're aware of. So for example, have you eaten a lot of processed foods that are dyed with red dye number 5 or yellow number 3? Do you love Skittles and you're always eating something that's got these really bright colors? Did you change the oil in your car all the time and you constantly had your hands in gasoline or solvents or oils? Did you constantly spray glyphosate in your yard to keep your weeds down? Did you constantly spray for spiders in your home? Did you order pest control every month because you got critters and creatures all over the place and you're trying to kill them, so there's some exposures there? Do you live in an environment where they crop dust the farm all around you on a regular basis? I've told this story a couple of times. Coming out of COVID, when we'd all been holed up in our house for a long time, a local high school in my in-laws area, they lived in a small farming community in northern Utah, they were going to have their first high school football game. And we were so excited to get out of the house and just interact with people. So we drove to northern Utah and went to this football game. And we pull up, park in our car, and it's in this beautiful farming community. And we get out of our car and we're wearing our masks. And we walk in and sit socially distant from everyone in the stadium. So we're minding our business. And I look and a crop duster flies right next to the stadium and leaves this big plume of pesticides on this farm. And this crop duster made about 10 passes right next to the stadium. And I thought to myself, here I am trying to be a good citizen avoiding COVID, and I'm just inhaling all these pesticides that have been crop dusted right next to my family. We walked out over our car. It looked like I'd sent my car through a car wash because there was spray all over my car. Needless to say, I was kind of irritated by that. Okay. Known exposures. How about your career? Did you work in an environment where you were constantly exposed to things? I have one client with Parkinson's disease that worked as a housekeeper at the INL National Laboratory site. And in housekeeping, she had an exposure to triethylchlorine that put her in the hospital, and she now suffers with Parkinson's disease. And triethylchlorine and Parkinson's have absolutely been linked. So that's now a work comp claim for her that she's trying to work through that's now 20 years old. Okay. So sometimes knowing what your career is. I had a physician when I first started practicing this style of medicine, 2015, where I was walking through all these details. He was a radiologist trained from the Mayo Clinic, and he had 2 tours in Iraq, lived in a barracks next to a burn pit. And so he said, the smell of plastic has never left my nostrils. I can smell it to this day because there was no trash service in Iraq. All of their medical supplies, all the plastic water bottles, everything they had went right outside the barracks and they lit him on fire. And he says there was a smoldering black fire every single day of the 2 years he spent in Iraq. He came home in his early 50s, was diagnosed with Alzheimer's disease, and forced to retire as a radiologist because of that. I've always saved his progress notes and his testing. That reminds me that even doctors or engineers with a high level of education and that work, quote unquote, in a sterile environment, haha, you see my cynicism there. Everyone has some potential risk. So give yourself a hash mark. Next one, head injuries, concussions, and TBI. Listen to how I word this. I want you to make a hash mark for every historical concussion or slip and fall, even if you thought it was a very insignificant head injury. Maybe you did lose consciousness. Maybe you didn't. Maybe you just had to go to the ER and get stitches or staples in your head. Maybe you were in a car accident and experienced a little bit of whiplash, or you played college volleyball and you took a couple of spikes to the head. Maybe you were in a motor vehicle accident, or you had a ski injury or a motorcycle injury or a biking injury. Gone are the days that I ask people, have you ever had a concussion? Because even in today's environment, no one even knows how to define what a concussion is. No one has the foggiest idea. Right? I coach high school soccer, and a little girl came off the field after taking a soccer ball to the face, and she sat down, and I said, you got a headache? And she said, yeah. And I said, hey, you got a concussion. You're out for the rest of the game. I do not have a concussion. I didn't lose consciousness. And I said, no, I'm not putting you back in. You have a concussion. I'll talk with you after the game. I got to keep coaching. People have no idea. Just because she didn't go to the ER, just because she doesn't lose consciousness, does not mean she was not concussed. Okay? And so I'll ask my clients, tell me your most significant history, or tell me about your mini traumas, anything that you think was a mini head bump. Have you ever had a seizure? Give yourself a hash mark if any of those come back positive. Okay? Cardiovascular risk factors. I want a hash mark if you've ever had a rhythm disturbance, if you've ever had atrial fib, been diagnosed with a low heart rate, that's called bradycardia, or if you've ever had a heart attack called myocardial infarction, or a stroke, that's a CVA, or a TIA, which is a mini stroke, transient ischemic attack. Have you ever had a coronary artery bypass graft, meaning that they went in and bypassed a couple of your arteries, or have you had stents? That deserves a hash mark. What about your blood pressure? Is it always elevated? Do you go to the doctor and say, I just have white coat hypertension. I really don't have high blood pressure, but Randy, you make me nervous when I come and see you, so my blood pressure goes up when we have a conversation. Have you ever been told you have high cholesterol? Have you ever had a DVT or a blood clot? Have you ever had Raynaud's phenomenon, erectile dysfunction, some form of a vasculitis, or do you have varicose veins where your actual blood vessels have lost their integrity and balloon out and look like garden hoses? Any cardiac or thoracic surgeries? Have you ever had any vascular surgeries? Okay, so if you've ever had any of those, you take a hash mark down, right? That tells us there's a potential risk factor. Autoimmune disease is next. Autoimmune disorders are so tricky because sometimes people have markers of autoimmune disease, meaning that they've checked their rheumatoid factor or their anti-nuclear antibody, or they've looked at other antibodies against their thyroid gland. We call those thyroid peroxidase or thyroid globulin antibodies. Some people have a formal diagnosis of psoriasis or rheumatoid arthritis or ankylosing spondylitis or lupus. Yesterday, while coaching high school soccer, I had a young lady that had it look like a scar on her knee. And I said, oh, that looks like a wicked injury. That's a bad scar. She goes, no, sir, I just have psoriasis. So that plaque has erupted and I scratched it and it's scarred down. Now it's gone. And I'm like, I did not realize that you had psoriasis. And I said, how are you treating it? And she said, I stopped eating so much sugar and all my plaques went away. I thought that was so interesting. She's not on any medicine. She just changed her diet and her psoriasis seemed to settle down. Okay? She would get a hash mark for psoriasis. Gastrointestinal health. As a category, this is just as complex as autoimmune disease because many people have symptoms without a formal diagnosis. People will say, I get acid reflux. I get abdominal pain. I have irritable bowel. And is irritable bowel a formal diagnosis or is it a descriptor? It's kind of like fibromyalgia. We got to figure out what's driving that. Are you chronically constipated or do you have chronic diarrhea? That would get a hash mark. Well, then I ask people, are you doing anything for treatment of your stomach issues? Because maybe they haven't gone to a GI doctor or they don't know what's causing this, but they are taking a bunch of magnesium or other supplements to poop. Maybe they just have a lot of symptoms like colitis. So 20 years ago, they were told, yeah, you have collagenous colitis or lymphocytic colitis, and there's really nothing you can do. So now you just deal with the symptom. We have a client in New York City that had chronic fatigue, and in her history, she'd had a weight loss surgery or she'd have a partial colectomy, right, where they remove part of her colon. That's going to change electrolyte status and absorption rates of how you're able to absorb electrolytes through the colon. I have a patient who's a dental hygienist who went to Mexico and had a weight loss surgery and then about a month later had a terrible seizure and ended up diagnosed with beriberi. And now she walks with splints like she has polio because she had such a vitamin deficiency from that weight loss surgery. Okay? If you've ever had any GI surgery, like your gallbladder removed, that gives me an idea of what's going on in your belly. If you don't have a gallbladder, there was a period of time you were not moving bile. And that would mean that you're more likely to have a toxicity issue because the bile is how you stabilize toxins in the liver and transport them to the sewage into your colon. How about food intolerances? It's not uncommon that people say, I can't eat eggs, I can't eat gluten, I can't have dairy. Those cause terrible GI symptoms. That would get you a hash mark. Okay. Musculoskeletal health. How about osteoarthritis? We used to think that osteoarthritis was just an overuse problem. It's actually a chronic inflammatory condition. There can be some transmission of that to inflammation in the brain. How about osteoporosis or osteopenia? That's inflammation that affects bone problems. Osteoporosis, did you know it's actually an inflammatory disorder? What about your gait? When you walk, do you have a nice strong gait? Do you strike on your toes or on your heels? Do you have any tremors? That would give you a hash mark. These are risk factors that we would want to pay attention to and try to investigate those. Thyroid history. Do you use any thyroid medicine? Did you know that every single brain cell, every nerve, every blood cell, every single cell in your body has a thyroid receptor? So it can predict how well your metabolism works just based on your thyroid health. Do you have any nodules? Has there been any autoimmunity? Are you always cold? If you live in Arizona where it's 150 degrees year round and you sit in a room that's 74 degrees and you have to have a throw blanket because you're freezing all the time, that's probably a thyroid issue. And it might be a thyroid brain issue that we would have to talk through. That would give you a hash mark. I've shared this story. I think I just shared it recently with a lady that approached me and said, Randy, you changed my life. I poop every day. And all we did different was up thyroid medicine. Change the actual thyroid medicine that she's taking. Added a little T3 because she was only on T4, which is called Synthroid, and she probably didn't convert it to T3. And the bowel is sensitive to T3. What about your sex hormone history? I am so grateful that we live in an era where we're recognizing the benefits of hormone replacement therapy. Those days existed in the 80s and 90s where women took hormone replacement and felt better and did better. And then in 2000, that dreaded study called the Women's Health Initiative came out where hormones were frowned upon, looked at as risk factors for breast cancer and blood clots, and the use of hormones almost died out for about 20 years. But more and more, we're recognizing that menopause causes brain fog, right? Hormone replacement therapy makes it better. Testosterone replacement therapy. It used to be we just did hormone replacement therapy in women because they went through menopause. Just eliminating the fact that men's testosterone levels also fall over time, and men do better with hormone replacement and hormone optimization as well. There's a lot of research that says if you've ever had a good concussion or a head injury, you are more likely to become menopausal sooner in your life and more likely to have hormone disorders because of that concussion. Because when we hit our head, we can damage the pituitary gland that communicates with the rest of our body. So knowing your hormone history gives you a hash mark if there's menopause or symptoms of low hormone levels. Metabolic health. Oh my goodness, I've given 10 lectures on the impact of insulin and insulin resistance, diabetes type 1, diabetes type 2, late onset adult diabetes called LADA, LADA, insulin resistance, hyperinsulinemia, polycystic ovarian syndromes. These are all things that I've talked a lot about. But you would only know that if you're actually looking at your insulin level, or if you're paying attention to your triglyceride levels or your A1C. What is your weight? Now, this is a tricky one because I've never met a woman who didn't want to lose 10 pounds. Okay? I've never met a man that didn't slap his belly and laugh and say, oh, I got a little extra there, but I'm happy with it. No big deal, right? So men and women view weight issues very different. And sometimes weight can be contributory to metabolic disorders. Sometimes it's a symptom of or a sign of a metabolic disorders. If you use any medicines to try to control your blood sugar, that would earn you a hash mark. And I would want everyone on our call should at least try a continuous glucose monitor at some time in their life so they can recognize how food affects your blood sugar. Now, Grandma Jojo said, I sleep better when I have a little peanut butter. The likely reason behind that is peanut butter likely stabilizes Joanne's blood sugar and insulin through the night. And if her blood sugar drops, she's more likely to wake up from a stress response. So if I'm trying to add interpretation to Joe's statement that a big tablespoon of peanut butter helps me sleep better, that's how I would describe that. So, Mary, if your husband wore a continuous glucose monitor, we would know if he's having low blood sugar episodes at 2 o'clock in the morning, and could a more higher protein, higher fat diet help him sleep better at night. Dental health. If you have problems with your teeth, you have earned another hash mark towards brain fog or potential cognitive problems. If you have a history of root canals or gingivitis or periodontal disease or implants. About 4 years ago, I was asked to be a guest lecturer at a dental continuing ed conference for dental hygienists and dentists across the state of Idaho. There was about 100 people there earning continuing ed. And my message to them was the impact of dental health on cognitive disorders like major depression, anxiety, dementia, Parkinson's disease, all types of cognitive impairment. And after, all the dentists and hygienists would come up to me and say, you know what, I've always known dental health was important, but you helped me to see how valuable it is for people's cognitive problems. Thank you so much for teaching us about cognitive problems and the relationship to dental health. What are your dietary habits like? Are you constantly searching for the sweets? Is that sweet tooth taken over your life? Are you a comfort food junkie? Do you finish every day on the couch with chocolate-covered cinnamon bears and potato chips? Are you eating high-processed foods? Do you like fruits and vegetables? What's your protein intake like? Those types of things would either earn you a hash mark or subtract them. And in medicine, since there's so much opinion about diets, these are the three questions I ask. These are the two questions I ask my clients. I want you to tell me the three healthiest foods that you ate this week. And people think, what did I eat that was healthy this week? I learned something about them when they said, well, last night I had salmon and broccoli for dinner. Yesterday I had a large dinner salad and I eat eggs every morning. I think that's pretty healthy. I'm like, oh yeah, this person, they understand diet. If a person says to me, well, I don't really like green vegetables, but I did have lettuce on my hamburger, or they say, I added sprinkle nuts and strawberries to my frozen yogurts, and I know that nuts and strawberries are healthy. Or if they say, I had fruit snacks made with real fruit, then I think, okay, we've got some education to do. They deserve 3 hash marks because their diet's not very good. And it's always fascinating when this is no lie. I had a patient, she was there with her mother who had dementia. And I said, tell me the 3 most unhealthy things that you eat. And she says, well, every Tuesday night we eat wings at the bowling alley. Thursday night is the Maverick dinner tour. And I'm like, what in the world is the Maverick dinner tour? And she goes, you know, when you go into the Maverick gas station and they have those frozen burritos and hot dogs and Polish dogs and nacho chips, and we get a soda pop and a candy bar. We call it the Maverick dinner tour. And then she said, and we really love Taco Bell. It's probably not that healthy. So those are probably the 3 unhealthiest things that we eat. And then I think, oh my goodness, we have a lot to do. That is an absolute true story coming from a client that I've seen in the last 90 days. What are your exercise and activity habits like? You get a hash mark if you live a stationary lifestyle. You would get a hash mark if you're like Randy Vawdrey. I took my soccer team and practiced this morning from 7 to 8:30 and was physically active. And then I will spend the rest of my day in this chair. That is not an active lifestyle. I have to work really hard to be physically active because I spend 8 to 10 hours a day sitting at a desk looking at a computer. That's how I practice medicine. I've always found it fascinating that we call an active lifestyle if we get up and go to the gym for 45 minutes 3 times a week. That's not a very active lifestyle. Okay, so do you go more often to the gym? Do you track your steps per day? Do you go on a walk every day after lunch for 15 minutes? Are you getting a lot of physical activity going on, or are you physically incapable? Do you have a total knee that's gone south and you can't move? What are your activity goals? So when I'm talking with people about physical activity, it's not just getting dressed in your Lululemons and going to the workout class twice a week. Physical activity is embracing this concept that for every hour that I spend in this chair, I got to spend 10 minutes up and walking and doing stairs and so forth. That makes a difference to brain fog. Sleep quality and sleep challenges. What are your nighttime routines? Do you have a television in your bedroom? Do you look at your phone all night long? There was a time that I had to tell one of our clients in our membership program, you are not allowed to text me after 10 o'clock at night and before 9 o'clock in the morning. Because I'm getting these texts and these emails at 2 a.m. and 3 a.m. and 4 a.m. that would say, Randy, can you look at this study? Randy, can you? And I finally said, what in the world are you doing at 2 o'clock in the morning? Because I'm sound asleep. What are you doing? Well, I can't sleep very good. So that's when I start reading on my phone. And so part of my consultation with her is, hey, you got to knock this off. I want your phone in the other room turned completely off. And if you need to get up and get a drink and you want to read something, get a book and a flashlight. Don't use your LED on your phone. Do you snore? Do you have sleep apnea? Do you have apnea episodes? Those would all give you a hash mark. And I printed in this summary, this is called the Epworth Sleep Study. It's a sleep questionnaire. So I want you to ask yourself these questions. This gives you a hash mark. would you on the upper right hand corner or upper columns, would you ever nod off? A slight chance that you would nod off, a moderate chance, or goodness, you're falling asleep when you do these things, when you sit and read a book. When you watch TV, are you likely to nod off and fall asleep? When you're sitting in church or in a public meeting, when you're driving in a car as a passenger, do you just fall asleep instantly? When you lay down in the middle of the day, can you fall asleep instantly? Can you fall asleep talking to somebody? I've told you this story. When I was growing up, my dad served in the ministry of our church, and we would call on families and share a spiritual message with them. And when we would do that, one time my dad was sharing a spiritual message with this family, and his speech got really quiet, kind of faded off, and I looked at him, and he's like this. And I thought, oh my gosh, my dad is so damn boring. He even puts himself to sleep, right? That's what I said as a snarky little teenager. But the reality was, my dad probably had sleep apnea, and neither he nor I were wise enough to figure it out because he put himself to sleep talking. Okay. How about when you stop at a traffic light? Have you ever fallen asleep? This is an actual validated sleep questionnaire to try to figure out how dysfunctional is someone's sleep. You get hash marks if you're likely to nod off during any of those instances. Do you use alcohol? There is no redeeming value to alcohol. Some people would say, well, I have anxiety in social settings, and one glass of wine allows me to relax and have a conversation. I get that. I acknowledge that's probably one redeeming value, but you're going to pay for it because your sleep's going to go south that night. Alcohol completely changes sleep. Do you smoke? Are you a historical smoker? That would give you a hash mark. Do you use recreational drugs? One of my questions that I ask people is, do you use marijuana? Marijuana is legalized in many states across our country, and because it's become legalized, society has become very permissive about the use of THC. You have to be careful about that. THC is much more likely to induce terrible mood disorders, depression, anxiety, schizophrenia, bipolar disease, and can lead to dementia, almost without question, somewhat depending on how often you're using. Okay? And from social habits, I'm always curious about people's spiritual or religious beliefs. Why am I curious about that? Well, number one, community matters. Social environment matters. People with a strong spiritual community get together often on their day of worship. They interact with each other. They're usually talking about things that are a little bit more spiritual and uplifting in nature. Good poetry can do the same thing. But that reduces risk long term of cognitive problems when we have a very social or spiritual way to calm our fears, settle our stressors, connect with our loved ones, and think of something beyond the moment here and now, something that's more divine and spiritual. What is your history of chronic infections or viral health? Do you get COVID every year, and does it kick your butt when you get it? Do you get COVID long hauler syndrome? Have you responded really negatively to influenza on a number of times? Do you get repeat cold sores? Do you get chronic urinary tract infections? Do you get repeat cellulitis or skin infections? Have you had repeat pneumonia over and over and over? That's going to affect your respiratory system and compromise your ability to get oxygen. Do you have chronic Lyme or chronic tick-borne infection like babesia or borreliosis? Or do you have valley fever, which is another fungal infection that's common in the Southwest? Okay. Have you ever done any cognitive testing? You get a hash mark if the answer is no, because you can't track your cognitive functioning unless you're actually measuring it. I hope everyone on this call today would make the personal commitment to do a cognitive test every year of their life until you pass away. And the reason I want you to do that is it helps you track progress over time. We do this with our weight. We do this with our cholesterol. We do this with our blood sugar and A1C. We often track our sleep. We track our finances. We track our lab work. I want you to track your cognitive function. It helps you to identify if there is a problem. And there's lots of ways to do that. So I want to stop sharing, and I'm curious. You don't have to give me a number, but I would love for you to type in the message, if you will, how many hash marks you have. Now, if you don't want to do it, you could make it up. You could fake it. You don't even have to post it. But my point is this. Do you remember when we were talking at the very beginning? I know it's just been a short period of time. We were talking about brain fog and this risk assessment form. Well, let me give you an example of you. If I'm working with you specifically, I'm going to start asking you these questions. Tell me a little bit about your medical history. And I'm going to try to gather as much detail as I can because that helps me identify what is driving your brain fog. I just walked you through a medical history that Randy Vawdrey would do through a telemedicine process, okay? The next one is I would want to know a little bit about your hormones. I did a telemedicine consult, and my delightful patient this week sent me an email with a 3-page summary of what happens when she tried to start hormone replacement therapy. I gained so much information from that. She took great notes, and there was time frames and dates and adverse effects and symptoms. She's very wise because she recognizes that plays a role in cognitive function. Then I'm going to focus on your metabolic health. This is what's going on with your diet and your blood sugar and your CGM and your insulin levels and your uric acid levels. I want to know that. The next thing I'm going to ask you is about your nutrients. Are you taking any vitamins and minerals? If you are, what are you taking? What do you know about them? Are you doing repeat testing because you have them? Eric and I had a client that came all the way from out of state to Boise packing a suitcase. And all of you travel with a suitcase, but something unique about her is she had one suitcase that had her clothes and another suitcase that had all of her supplements. And when I say a suitcase, it was the most impressive thing I have ever seen. And it was, well, I take this one because my sister sells this supplement, says it's good. And I take this one because at Costco they had someone doing a trial and said it was really good for your bone health. And I take this one because when I was at the grocery store, I read an article in People magazine about this supplement. And so my point was know what you're taking, know what your levels are, and marry those two together. Reconcile it like you would reconcile your bank account. And then I would consider nutrient challenges. For many nutrients, it is not enough to just take the supplement. You want to take it in high dose because the research is overpoweringly good about that supplement. And the top of my list is an omega. All of the cardiovascular research says if you take 1,000 milligrams of an omega-3, it's better than not taking any, but it's not as good as taking 2,000. And 2,000 isn't as good as 3,000 or 4,000 or 5,000. The studies went up and said as much as 12,000 milligrams a day had the best outcomes. Now, for you to get 12,000 milligrams of omega-3 of a high dose, you'd have to be very selective about the supplement, take 12 a day. Okay, that's why those nutrient challenges matter. Right now, there's a $45 million clinical trial studying the use of high-dose vitamin B1 in Alzheimer's disease. We just heard this last week that autism has now been linked to low folic acid levels, and the recommendation for children is they take a very specific folic acid supplement called leucovorin. So we would want to challenge those nutrients. The next thing is we would look at different therapeutic options. There are things that you can do that protect your brain and minimize brain fog. Things like sauna therapy. We already talked about exercise or hyperbaric oxygen or PEMF or grounding or red light therapy. These all have tremendous research of optimizing blood flow, minimizing brain fog, calming inflammation. Okay. The next one is I'm cautious with certain medicines that have a lot of risk factors to them. So, just like in Alzheimer's disease, if we have high cholesterol, we don't try to figure out why we have high cholesterol. We just take cholesterol lowering medicine. Well, that's a problem, right? We should try to be more thoughtful about, are these medicines inducing some brain fog? I would ask you about your lifestyle because lifestyle matters. I would ask you to join our support group. Guess what? You guys all have joined our support group. You're here today. This is the A Mind for All Season support group. We call it a membership program, but it's really a support group where you can come and ask questions on certain days of the week and receive continuing education on other days of the week. That is so valuable. Come with questions, bring your supplements, challenge what we're doing. We're ever learning and ever sharing. The way I practice medicine now is not the same as it was 10 years ago. It's not the same as it was 5 years ago. I'm growing in this space and I'm not stingy. I'm sharing it with all of you as much as I possibly can. And then sometimes there's just things we have to cover individually: autoimmune disease, gut health, hormone replacements, concussion. Sometimes you just can't get specific enough in a large group setting, and that has to be done through telemedicine.